Hello, I am Dr. Ankur Garg, Director Liver Transplant and GI Surgery at Paras Group of Hospitals, Delhi, India. Liver cancer, or what we commonly even a common man knows the name, we call it HCC, which stands for Hepatocellular Cancer or Hepatocellular Carcinoma. So there are a lot of questions, a lot of doubts about it. That is liver cancer curable? Can surgery happen in HCC? Can chemotherapy happen in HCC? Can radiation cure liver cancer? So it is very important for us to understand that how a liver cancer happens. So 90% of the people who will have a HCC means a cancer arising from the liver, not a cancer which is arising from somewhere else and which has come to the liver, which is called as metastasis. So if you ask me which is the most common liver cancer is a metastatic cancer. That metastasis can be coming from breast, from stomach, from large intestine or from ovaries. And the less common liver cancer is a hepatocellular cancer, which is a cancer arising from the liver and not coming from somewhere else. So more than 90% of the HCCs, they will arise in a liver which are already damaged, which already have cirrhosis. A normal liver has a very less chance of developing a primary HCC. So we have to understand that in majority of the cases, when we come across a patient with HCC, he is also suffering from an underlying liver disease. So just taking the care part of the HCC is not going to cure the problem of the patient because the liver is also damaged. If we remove one HCC, sometime down the line, second HCC will come because the liver is damaged. So it depends that when we deal with HCC, are we dealing with a patient who already has cirrhosis and HCC, or are we dealing with a patient who only has HCC? If patient's liver is fine and he only has HCC, then there are a lot of treatment modalities. We can do surgical resection, we can do microwave ablations, radio ablations, we can do angiographic procedures like TARE and TACE. So it all depends upon that stage of the disease. I'm not going into the details of it. Coming to patients, majority of the patients with HCC who have an underlying cirrhosis. So for them, if the disease is limited and it is controlled within the liver, the most common treatment option that comes out after their evaluation is liver transplant, because it not only takes care of the liver cancer, because in liver transplant the whole of the damaged liver is taken out, it also takes care of their underlying diseased liver, and that is why they resume their life to normal. So if we talk about just management or treatment of HCC, it's such a big algorithm that even 2 hours or 3 hours of video will fall short in explaining all the treatment modalities of HCC, but we need to understand that most of the times when we're dealing with HCC, we are also dealing with underlying liver disease or cirrhosis. Thank you.